As Julie mentioned, my name is Anna. I'm one of the lymphedema therapists here at Altman Hospital in the Lymph Clinic. I've been an occupational therapist for about 16 years, and I'm a lymphedema therapist, which I've been for 8 years. And this is a topic that's really close to my heart, and I'm very passionate about it. So I'm thankful that all of you have come to join us to talk about this. So it's inevitable that during any of my health talks or an evaluation, when I'm seeing a person for the first time, that they kind of look at me dumbfounded and say, why didn't anybody ever tell me about this sooner? Why didn't the doctor refer me to you? And why didn't I have treatment? And, you know, we've come a long way, medically speaking, in the lymphedema world in the last 40 years, but we have a long way to go. And a few years ago, Dr. Roxon from Stanford University, he's kind of a lymph guru, did a study. And in this study, he asked medical students in four-year medical colleges in the United States and Canada how much time they're receiving on education about the lymphatic system during the 4 years of medical school. And the results are very telling, I think. 23% of the students said that they received 15 minutes or less time spent on this education. 29% received 15 to 30 minutes, 9% received 30 to 60 minutes, and only 28% got 1 to 2 hours of education. And this is on the whole healthy and unhealthy lymphatic system. So is it any wonder that if these physicians aren't really learning about this condition, that they're not recognizing it? So it's going undiagnosed, misunderstood, and people aren't receiving the treatment they need. So that's why we like to do these health talks, so that patients can be advocates for themselves to learn a bit more about what's out there and how they can recognize this condition and treat it for themselves. So when talking about lymphedema, I like to give just a good understanding of what a healthy lymph system does, so we can understand what happens when it's no longer healthy. The lymph system is set up kind of like a city infrastructure. First, we start with the garbage service. Your body has its own natural garbage service in the lymph system because it comes along all over the body and it removes waste products, picks them up and carries them away. In the lymph system, the main waste product is protein. We're going to talk more about that in a little bit, but it carries it away so it can be processed and removed from the body. We also have our police force. The lymph system is part of our immune system. So when the lymph system isn't working, our police that fight infections and diseases isn't functioning properly in the affected area. So people can be more likely to develop infections if they don't have a good police force. We also have a recycling plant of sorts, because as it's picking up and removing all this stuff from the system, the body's lymph system will actually clean and filter the fluids so that it can be reused as appropriate. And finally, it's similar to a sewer, as yucky as that is to say. The sewer systems help to balance fluids, and your lymph system does this. And whenever it's backed up and blocked, we will have an overflow, similar to a sewer, but in this situation, it presents as swelling. So what is lymphedema exactly? It's basically when our infrastructure that we just talked about begins to fail or break down and all of the system fails. It's when our garbage service is no longer picking up and removing protein out of the body. And so it sits there and blocks things up, causes more swelling. When the police force isn't working, as I mentioned before, you get those infections. When your recycling plant isn't cleaning and filtering fluid, you have lack of what you need and too much of what you don't need. And that just kind of transitions right over into our sewer system. When everything's blocked up, it overflows and we have swelling. So simply put, lymphedema is a buildup of protein-rich lymph fluid that gets stuck in the skin. I want to be really clear that this is not protein you eat. So please don't change your diet unless your doctor tells you to do so. This is protein on the molecular level. And what we know is that protein and water are chemically attracted to each other. And so as long as that protein is stuck in the skin, it's going to keep perpetuating this problem. Lymphedema can develop anywhere in the body, the face, neck, chest, genitals, legs, arms, and it can happen to men, women, and children of every socioeconomic status and all over the world. It's really not choosy, but once this kind of swelling occurs, it's not curable. It's manageable with good care, but we can't ever prevent it from happening once it's occurred. So what causes it? Why do we have lymphedema? And there are two primary types of lymphedema. They're determined by what causes the lymphedema. So our first one we're going to talk about is primary lymphedema. This is a situation where the body is, or the lymphatic system is malformed in some way from birth. It doesn't mean that the person swells immediately at birth, although you can see in the photo here that there is a baby with some pretty significant edema there. But it presents at some point in the person's life. Our bodies are really miraculous, and they're able to compensate very well for problems. So the body oftentimes compensates until there is too much stress to the system. Various things that can cause stress to the system in primary lymphedema are puberty, pregnancy, menopause, or just major medical conditions. Basically, it's a straw that broke the camel's back situation, and once you have that straw, you've got the swelling, and then it's present continually. This is most commonly seen in the legs and most often in women, but it can happen anywhere in the body, and it can happen in men as well. The second cause of lymphedema, or type of lymphedema, is secondary lymphedema. This is basically when an otherwise healthy lymph system is damaged in some way. We're going to talk about how that can happen. But basically, it's a healthy lymph system damaged, and then it's no longer able to cope with the demands placed upon it. And not everybody who has damage to their lymph system is going to immediately see swelling, or ever necessarily. There's really no good way of knowing who's going to develop it. So when a person is at risk, it's very helpful to know before the swelling ever occurs so we can protect that person. Sometimes it can show up months, years, or even decades after the original injury is sustained. So who's at risk? What puts them at risk? I would say one of the biggest ones that we see in our clinic is surgery. And this can be something like a total knee replacement. It can be a mastectomy. Anything that damages the lymph nodes through surgery puts a person at risk. A lymph node dissection, which is also a surgery, but it's a specific removal of lymph nodes. Radiation therapy to a lymph node bed. Repeated cellulitis infections. Severe or recurrent deep vein thromboses, or DVTs. An injury. Travel to a tropical country can sometimes lead to a parasitic infection. The filariasis happens when a parasite enters into the lymphatic system and breaks it down. So that picture that I showed previously of secondary lymphedema, that's a gentleman that has filariasis lymphedema. Sometimes your family history can be to blame. This does run in families, and most often we would consider that to be primary lymphedema. And then obesity is another one that we're seeing, unfortunately, quite a bit these days. Lymphedema does follow a pretty predictable stage progression. First, we see pre-stage or latent lymphedema. This is not true lymphedema. In fact, there's no swelling at all. This is when a person has had damage to the lymphatic system and they're at risk for developing lymphedema. So an example of this might be a woman who has had a mastectomy and lymph node dissection, and after the initial healing time, she has no residual swelling, but she may feel a little bit different. It may feel heavy or thick, but only to her, and there's no visible swelling. At that point, they're considered pre-stage or latent lymphedema. There's also stage 1 lymphedema, which is when the person develops actual swelling. At this time, the swelling can be big or small, it doesn't matter. It's very fluid and the skin remains soft. And when you elevate the limb, the swelling does go down after a period of time. An example of this would be when I come home at the end of the day, I have swollen ankles, and I might see a ring for my sock. But if I sleep in bed all night, I get up in the morning after my legs have been up, the swelling is gone. That could be evidence of stage 1 lymphedema. Now, stage 2 lymphedema is when the swelling has progressed. Typically, the swelling becomes greater in size. And what we notice here is that the skin is thicker. It's not as movable and fluid under the fingers when you touch it. And they're typically very high risk for wounds and infections in this stage. What it would look like is if I were to use the example from before, but instead of waking up to ankles that are no longer swollen, now I've got ankles that are still swollen despite 8-10 hours of elevation in bed overnight. And the final stage is called elephantiasis, or stage 3. This is probably the one that most people think of when they think of lymphedema. If you Google it, which I don't recommend you do, but if you Google it, you'll see all kinds of terrible pictures. They're typically of someone with elephantiasis. At this point in time, the swelling is very uncontrolled. It no longer reduces in size, it just continues to get bigger, and the tissues themselves have changed significantly. They develop warty-like bumps, which is where it gets its name of elephantiasis, elephant skin. And sometimes the skin becomes so stressed, it'll begin to leak lymphatic fluid just from the pores. It's not uncommon for these people to have frequent and poorly healing wounds, but also infections such as cellulitis. So as you can imagine, it's much better to catch a person in pre-stage lymphedema so we can prevent it from ever getting worse, as opposed to us seeing them when they've gone years untreated and now they're at stage 3. And I know in my clinic, there's a lot of confusion about the difference between lymphedema and just standard edema. And it's important to know what we're dealing with so we know how to treat it properly. So I put together this slide in hopes that it helps to clarify that. So we're going to talk about lymphedema first. Lymphedema is made up of high protein swelling. So protein is the hallmark of this condition. When someone has lymphedema and the swelling is there, we often see skin texture changes, which we've talked about previously. We see frequent and repeated hospitalizations for cellulitis. And the doctor might put them on water pills, diuretics, but they don't see any visible change to the edema. And we're going to talk about why that is. But basically, if we're not moving that protein out of the skin, it's staying in there, and protein and water love each other. So the protein is going to continually call the fluid down to stick to that protein. So we don't see the medicine helping with this. And we see poor wound healing. Now, converse to that, traditional edema, which might be after an ankle sprain or congestive heart failure, acute kidney injury, things of that nature, that edema is low protein in content. And because it doesn't have the protein sitting there causing problems, we don't see skin changes as frequently. And when this person is given water pills, it typically helps to reduce the fluid significantly. But we do continue to see poor wound healing with this type of edema as well. All right, maybe, there we go. So what does lymphedema actually feel like? It's very rarely painful. The only times I see pain are when someone has received cancer treatment and maybe there's some damage to the nerves or other issues at hand that might be leading to this. But pure lymphedema is typically not painful. If someone comes to me and they say they're in severe pain, they're feeling like they need to go to the ER, I usually advise them to do so because this should not be an acute issue. If someone is so acutely pained and having so many problems, there's probably something underlying, such as an infection or some other nerve damage. What people typically tell me it feels like is aching and discomfort in the swollen area, a feeling of heaviness or fullness with skin tightness in the swollen area. And if you can imagine a joint being very swollen, it decreases the flexibility. So we see that as well. The swelling might fluctuate, going up and down. One minute you think you're fine, the next minute it's terrible again, and then it goes back down. And depending on where the swelling is, you can sometimes see numbness and tingling in the swollen limb as well. Sometimes people are referred to our clinic for conditions that look like lymphedema but are not actually lymphedema. We call those differential diagnoses. And most of the ones I'm going to talk about today actually can lead to lymphedema if they're not identified and treated properly in the beginning. The first one is lipedema. This is a condition that occurs primarily in females where their hormones tell the body to accumulate abnormal amounts of fat cells or cellulite in the abdomen, buttocks, thighs, and lower legs. Very occasionally you can see it in the upper body, but typically it's the lower body. It's not the type of condition that can be dieted away because the body has basically a cyclic system happening where it's constantly telling the body to save these fat cells, and no amount of dieting can change that. What we do see when these people try weight loss is they'll lose weight in the upper half of their body, but the lower body will stay the same size. And it's very frustrating for people who are working so hard to lose weight and they can't lose it in the lower half. When we see this condition, the legs are typically very symmetrical in shape and size. The feet typically don't have a whole lot going on. We call it foot sparing. And it's extremely painful. Just the lightest of touches sends these people through the roof, and they typically bruise very easily. Now, if it's not treated, these layers of cellulite on top of our little lymph hoses underneath can start to collapse the hoses. And so we don't have the proper drainage of the lymphatics, and it can turn into lymphedema. And if you look at these ladies in the pictures I have, the first photo, the legs are very similar in size and shape. Same thing with the second one, but by the time you get to the third lady, you notice that the legs aren't shaped the same anymore, and her left leg has a much larger lobule at the bottom. That's actually fluid that has now become stuck in the area because her body is not able to compensate any longer. So it's much better to catch someone in the first stage there of lipedema, so we can prevent it from ever getting to that third stage. Another differential diagnosis that we see a lot of and is actually being shown in research to be the leading cause of lymphedema is chronic venous insufficiency. And this is a condition where the valves of the veins become weak and tired, and it results in blood pooling in the legs. And as it pools, it leaks out chemicals that can stain the skin. You can see the gentleman here has darkened skin in the area. And initially, this doesn't cause swelling. It's not a swelling issue, although people get wounds and other issues from it. But what happens is the lymph system is trying constantly to remove that blood, to remove the fluid out of the legs. And over time, it just gets tired and fails. So it eventually can turn into lymphedema. Things that cause chronic venous insufficiency include maybe a job where someone's standing in one place for a prolonged period of time, or sitting at a desk with their legs down for a prolonged period of time. A sedentary lifestyle also, because they're not moving. Obesity is something that's causing a lot of this. And sometimes we just run bad luck, and it runs in the family. And so heredity can have something to do with this. We want to treat this before it ever gets to the point where the swelling is overwhelming the lymphatic system. And our final differential diagnosis is cellulitis. And you can see in this picture, I hope you have color screens, just how bright red this leg is. This is as angry and painful as the picture looks. And it's an infection that requires immediate medical attention with antibiotics because it can spread very quickly throughout the body, can become a systemic issue. So this particular type of infection attacks the lymphatic system, and repeated cellulitis infections can actually cause lymphedema in someone who doesn't have it to begin with. So catching this immediately, preventing the damage it does to the lymphatic system is very important. Things to look out for are a fever and just general feeling of sickness. But this is typically accompanied by that very red patch of skin that is painful, and you'll see it spread and cover a larger space over time. Again, this is emergent that someone received treatment for this when it's first diagnosed or first seen. So how do we treat all these problems? We've got a couple of programs that we use here at the clinic, but in all honesty, we will often pick from various places to tailor treatment to the person that we're treating, because not every body is the same. But our first gold standard treatment that we go to whenever possible is called complete decongestive therapy. This is where someone is coming to us regularly to address their edema, and it's done in 2 phases. The first phase is the reduction phase, and just like it sounds, this is the time where we're really focused on shrinking and reducing the swelling, improving the health of the tissues, and getting a person ready for their final containing compression garments. And during that phase, we use the 4 components below, which we're going to talk about in more detail in the upcoming slides. But when we're done reducing, we've got a person to where they're happy and they like what's going on there, we transition into the maintenance phase. The maintenance phase goes on for the rest of the person's life. This is where they practice what we've taught them and what we've done to keep things going in the right direction. So let's talk about those 4 components. We've got the manual lymphatic drainage, low pH skin care, compression, and remedial exercises. Manual lymphatic drainage is a hands-on technique that we use, and we use this to absorb and move all the protein that's stuck in the skin, so that as we move it up and out of the swollen limb, we take it to another place, another lymph area, where there are healthy lymph nodes that can do the job that the other ones weren't doing. And by removing this protein, we're also taking fluid with it. This is a very gentle, comfortable technique, and it really offers a lot of good benefits. It offers pain relief, obviously reduced swelling, and it'll even soften tissues that have hardened as the condition progressed. Probably the easiest part of this treatment is the low pH skincare. The body naturally grows acid on the surface of the skin, and this acid is there so that it can kill any bacteria that touch the skin and could potentially cause cellulitis and other infections. When we're using the kinds of products that smell good, make you feel squeaky clean, chances are they're not low pH, and what you're doing is washing the good stuff right off. So what we advise people to use is to use Dove soap. And then you've got a couple of choices with lotion. There's Eucerin, Aquaphor, Baby Lotion, and Cetaphil. They're all very good at helping to pH balance your skin. Avoid Zest, Irish Spring, Bath and Body Works, all those really good smelling things. You want to avoid those because they're not going to do your skin the benefit that you want. The most contentious part of treatment is compression. Unfortunately, there's no way to address swelling without compression. And compression looks different depending on what phase of the treatment we're in. During the acute reduction phase, we're using inelastic, that means no elastic, garments. And I've got some pictures here of the inelastic garments that we typically use. Because these garments don't stretch, when the muscle pushes against them, it helps to pump the fluid up and out of the skin. So these garments are really helpful to shrink a limb. Now, people are often familiar more with these type of compression garments. These are elastic, and while they do have a good purpose, they serve a purpose, they don't shrink a limb. So typically we wait to use these garments until we've reduced the pupil completely, and we transition into these garments for daytime wear only. At nighttime, people are still wearing these garments. We have lots of different options, and it's almost like an a la carte type of a thing, but we try to get the just right garment for the person to maintain their swelling during the day with these and these at night. And I always stress in these health talks, if you take nothing else away from my talk today, I hope that you remember that these elastic garments are safe for daytime wear only when you're up and moving. if you were to wear these garments to bed, there's a greater risk that you could develop a DVT or wound. And so these are safe for daytime wear only. Do not wear these to bed, please. All right. So the fourth component is exercise, and it's nothing earth-shattering. We call them remedial exercises most often, but they're very beneficial when a person is wearing compression of some kind, because again, that muscle pumps against that outside pressure, and it helps to push the fluid out. So the only restriction with lymphedema is that you don't cause pain. So as long as there's no pain, we do lots of exercises to help push that fluid out and keep it out. The second program that I alluded to earlier is our breast rehab program. We developed this earlier in 2020 in the spring in partnership with the Altman Cancer Center and Dr. Shalad, because we wanted to provide specialized care to people who are undergoing breast surgeries and therapy, because we were seeing a lot of soft tissue issues, range of motion problems, and pain following breast cancer treatment. So we've developed this program that offers soft tissue massage, stretches, exercises, manual lymphatic drainage. We do education, and we monitor for the onset of lymphedema. And when it's appropriate, we get people compression garments and we fit them with those. Now, as I mentioned before, complete decongestive therapy is the gold standard, but there are times when it's not appropriate for a person, or a person is just really not interested because it's too much, it's too involved. So at that point, we go to our alternative treatments. One of those is a pneumatic compression pump, and you can see a couple versions. These are the Flexi Touch pumps that we really like. These are worn for about an hour at a time, and the garments fill up with air in a targeted manner to push the fluid up and out of the body, or I'm sorry, out of the swollen area. They do not offer quite as much edema reduction as garments and the other treatments, but sometimes my theory has often been something is better than nothing. So we will use these by themselves or in conjunction with complete decongestive therapy to give the best benefit that we can to our patients. There are risks and benefits associated with this, so it's always best that a lymphedema therapist talk with the person to determine if it's the right option for them. So what are some things that we can do or not do to ensure that swelling doesn't increase, or that we don't actually move from that latent stage into stage 1? Some of the do's are that low pH skincare, do use Dove soap, use Rinner baby lotion, do wear sunscreen and bug repellent, do use an electric razor when shaving. You don't want those little nicks to cause problems. Always elevate when possible. Watch for signs of infection, and I put them here. They're red, hot skin, fever, and flu-like symptoms. Do always maintain a healthy diet and weight. There is no lymphedema diet per se, but a low sodium, kind of Mediterranean style diet is always a good idea. Do wear compression garments as recommended by your CLT or certified lymphedema therapist, and watch and treat immediately any open wounds or scratches, and get medical attention. Even if it seems like it's not that bad, something small can turn into something big very quickly. Don't take hot showers or use hot tubs or saunas. That can increase the swelling a lot. Don't allow blood draws or blood pressure readings to be taken in the affected limb. Don't carry your purse on the affected side if this is in your arm. And don't forget to replace those elastic compression garments every 4 to 6 months, no matter how good they look, especially if you've been wearing them every single day. Okay, they just don't offer the same benefit after that time. At times there may be situations where we absolutely cannot treat a person, even if they have lymphedema, and those times are called contraindications. Some contraindications I have listed here are acute deep vein thrombosis, an acute infection, acute congestive heart failure, acute or uncontrolled kidney failure, and cardiac edema. We can cause major harm if we treat in those situations. Now, there are other times where we just need to be careful. We need to monitor a person closely, We need to communicate with their physician regularly, and those times are called precautions. Sensory loss in the swollen area is one. If they've had a recent abdominal surgery or current irradiation to the area, if a person is pregnant, if they have a clot preventing device, or if they have an abdominal aortic aneurysm. All of those things, we just need to monitor closely to make sure we're keeping people safe. So a lot of those are physical obstacles that we just talked about. There are other obstacles to treatment that we see a lot of. Unfortunately, as the doctors trying to find a magic wand treatment, there is no such thing with lymphedema. And sometimes social barriers can become a very big obstacle to treatment. And by social barriers, I mean if a person lives alone and has no one to help them with either transportation or garment donning and doffing, that can really prevent a person from being able to take care of them or perform this treatment. Compliance is a big one. You can probably imagine that those big, bulky, inelastic garments are not the most comfortable or easy thing to wear. And so sometimes people just say, I don't feel like doing this anymore. And if you stop using it, you lose the benefits. So compliance is an issue. And finally, financial obstacles are big. Currently, most insurances have huge hurdles as far as getting garments covered, and some don't cover them at all. So that can become a very big barrier for people getting the treatment that they need. And there is currently the Lymphedema Treatment Act. It's been before Congress for years now. There are lobbyists, and basically they're trying to get Medicare to recognize that this is a necessary treatment. And if Medicare starts to cover it, then we feel that other insurers will follow suit. So if you're interested, I encourage you to go check out, just Google Lymphedema Treatment Act, and it gives you various ways that you can help promote this by contacting your public officials and any number of things. So I encourage you to do that. That's the Lymphedema Treatment Act. So if someone does feel that they would benefit from receiving treatment, we just need a physician referral, and that has to be faxed to the number that I have listed here on the screen. It's a referral for occupational therapy. And once we receive that, we set up an appointment for a therapist to do an initial evaluation where we'll ask lots of questions about your medical condition, the behavior of the swelling. We take measurements and inspect the skin. And from there, we can develop a plan with the person to treat the condition in the best way for the person. And I always like to end with this slide. This is actually a gentleman that we treated in our clinic years ago, the most compliant gentleman I think I've ever met. And this is, obviously it says there pre-treatment and post-treatment. On the left slide, you can see just how very edematous, and he does have elephantiasis, very edematous he is. And on the left leg, or I'm sorry, the right leg, you can see that white, yellow color. That is essentially lymph that no longer had a place to go, and it leaked through the skin and it dried there. You can see those deep crevices on his leg. It was very hard to get in there to clean them, so he had an odor. He had lots of infections. He had to have his pants specially tailored for him. Every pair of shoes he put on, he destroyed because the skin was so heavy and just laid on them. And he had a lot of difficulty walking. The treatment on the right is post-treatment of, I believe it was 8 or 9 months. He lost over 100% on each leg as far as size was concerned. And you can tell that the color is drastically different. He's so much better hydrated. There's no longer that dried lymph there. He was able to wear off-the-shelf pants, and he was a shoe guy, so he could wear his fun shoes again without destroying them. And most importantly, he had so much better comfort and ease of walking. He actually was able to go back to work again. He had been unable to work for a long time, but he was able to work again. So I like to use these slides to explain that lymphedema is incurable. You know, on that right picture, he still has elephantiasis, but it is manageable. He's in a much better place, much less risk for infection in that left slide. So this is a really important demonstration of what can be done even when it gets too far. It's always better to get something instead of nothing. And with that, that's the conclusion of the talk. If you've had any questions, I'm going to let Julie kind of let me know, and I'll answer any questions you have.